Health experts say the COVID-19 pandemic makes it more critical than ever for Canadians to get their flu shots this year. But safety protocols, such as doctors seeing patients by appointment only, they're making it difficult for healthcare workers to immunize everyone, especially children. And now Ontario pediatricians are warning of an imminent crisis, to use their words. Let's go back to Laura McQuillan once again, who has more on what the doctors are calling for. Laura.
Heather, they're saying that it's going to be impossible to meet that demand of people wanting to get a flu shot, probably more people this year than ever because of the COVID-19 pandemic. Because of those measures they have to follow because of the pandemic, things like distancing, they have to make appointments in advance, they have to disinfect their clinics. And when it comes to vulnerable people, we know that very young children fall into that category, and that's why Ontario pediatricians are appealing for help from local and provincial governments. One of those pediatricians is Dr. Jacob Rosenberg. He's from Woodbridge in Ontario. He told us that his clinic would normally do about 150 to 180 of these flu shots in a 3-hour period inside the clinic. He says this year there's no way they can do that while abiding by those distancing, etc. guidelines. In fact, he says that clinics across Ontario might be giving out fewer vaccinations than usual. Take a listen to what he told us.
150 to 180 people would come over a 3-hour period of time. That's an impossibility at this point. We can't just bring in droves of people to line up and get flu shots the same way that we've done in our office in the past. We know of clinics that are not going to be administering flu shots in their clinics this year because there's no way to be able to get it done in a safe way.
Now, he and other doctors want to see planning for large-scale flu shot clinics. They've suggested things like community centres or outdoor tents. They would also need support from nurses. They would need support to store those vaccines, but all of that, Heather, would require more money, and that's where the issue lies.
So as they call for more money and support, what are the health officials then saying in response, Laura?
Well, Dr. Rosenberg is from the York Region Public Health Area, and what he and other doctors who appealed for this help got back was a document of guidance and a checklist on how to run COVID-safe vaccine clinics for the flu. So they essentially got a how-to guide, but no logistical support. And our colleague Nicole Ireland has been speaking to York Region Public Health. She spoke to their Chief Medical Officer of Health, Dr. Kareem Kurju, who said he sympathises with those physicians, but the public health departments are already stretched thin. Take a look at some of the comments that we heard, saying, "We would like to work as cooperatively as possible, but ultimately, when it comes to actually the provision of nurses or the provision of dollars, that is not part of our mandate." We got a similar response from Toronto Public Health, both saying that mandate is with the Ontario government. They need to put up the money to get this done. So we reached out to them to find out would they give any more money or resources. A very short statement back saying more details on the influenza vaccination program will be available in the coming weeks. Doctors, however, like Dr. Rosenberg, saying they're getting a lot of calls from patients, from parents who are really worried about getting a flu shot this season. They don't have much time to get that plan and that program in place, Heather.
Laura, thank you so much.